Hey everyone, my name is Brennan Hodge. I am the founder and CEO of Citizen Health, and this is a public service announcement. Uh, this just became real for me. The time to joke about toilet paper on Facebook is over with. 45 minutes away, 6 people have died from the coronavirus. A mile and a half away is a hospital that has two positive and a lot of people pending tests. My wife works there. She was exposed. Statistically speaking, I've been exposed. This is happening whether we want it to or not. We've waited too late, and I want to quickly tell you why this is so imperative that we do something now. All right. So everybody's seen this. You've heard the term flattening the curve. Yeah, it looks cool and a nice little pretty chart. Basically, it says we've got to take some drastic measures to make sure we don't overuse or hit our capacity for ICUs and ventilators. Yeah, it looks cute, but in reality, what that means is anything over that line means people will die. 2 million people will die because we are running out of hospital beds and ventilators. Straight up. All right, so 2 days ago, the Imperial College COVID-19 Task Force put together a statistical disease model for Great Britain and United States based off the latest data from every country, the best report we can possibly get, and it's been validated. This shows this blue line is United States. This right there, see that little arc, that peak is that. This is when it's predicted to happen here in America. You see, May 20th. I mean, this is going to start peaking in June, right in the middle of summer. That's deaths per 100,000 population, by the way, 2.2 million. This right here came from that same report. You see the red line right there above, a horizontal red line right above zero. That's the critical care bed capacity. It's actually the number of beds we have in the United States for critical care, specifically with ventilation. We blow past that if we do nothing. And even if we shut down schools, and we have shut down schools, businesses, whatever, it's too late. It's not going to make a difference. We're above that critical threshold anyways. People will die because of lack of resources. All right, so this is a prediction by the CDC released, it was 4 days ago. Predicted to affect 160 million to 214 million people in 2020. I mean, that's close to 70% of America. I've seen upward projections of 80% of America within the rest of this year. And that's projections on the low end 200,000, high end 2.2 million. And that's just from the virus. This is not counting when our hospitals are filled up to the brim, all the people that have heart attacks and the gunshot victims and the just the wrecks, everything that actually needs critical care is going to be pushed away. We're going to have to triage deaths. This is terrible. All right, this is reality. You got ventilators and critical care beds. All right, so let me go to the next page. Blah, blah, blah. All right, there's three things that I'm pivoting Citizen Health and asking for your help. I've already got some people helping with this, and this could potentially be the largest coordinated initiative by humans ever, because this is the worst thing that's happening to humanity since the past 100 years at least. All right, so there's three things that we can do to flatten the curve. For one, treatments. There's a lot of good treatments coming through from Spain. I saw 6 or 7 today from physicians who are sharing it around. China, that's being translated. There's a lot of frontline professionals out there that are working tirelessly to get this stuff out there. And thank you for dedication. We need to help. We need to take all the treatment protocols and crunch them together and figure out what works best, not anecdotal evidence, like actually what works best. And let's apply AI to it. Let's leverage the technology we have to solve the problems that are coming by May the 1st. All right, so treatments. And speaking of that, a lot of this is medication that's on back order. That's just can't be bought. So we've got to start planning accordingly for this. Test, I'm not even going to talk about tests right now. That's been a disaster since day one. But I do know that a lot of labs are now starting to coordinate this. So what we're trying to do as well is build this platform that coordinates everybody with a need to the solutions that meet those needs. And right now we got treatments, testing, and ventilators. All right, so ventilators, I've already harped on that. If we don't have ventilators, we have no hope. Here's the thing with ventilators. you need somebody to manage this. It isn't just a breathing mask. This is pretty serious. You need a respiratory therapist, or it's potentially a battlefield promotion to some other healthcare worker. But whatever that is, we've got to get ventilators first. So how do we do that? Let me back up. All right, you can't order them right now. All these other countries are trying to order the same ventilators. America has just been dragging on this. There's talks of getting manufacturers to retool their stuff. Yeah, that's not going to happen in 30 days. I go ahead and tell you that. The only way we're going to get the actual number of ventilators that we need is to really think outside the box and 3D print them. There's a huge community of people out there in a 3D printing community that are donating their time, their 3D printers. There's over 500,000 3D printers, consumer grade, probably 50,000 industrial grade 3D printers. The idea is we've got to figure out what the best model is, because there's a lot of good ideas being tossed around. We've got to finalize that in the next 5 days. Then we've got to start printing these things at spec, quality control, get them assembled, put together a training manual, and ship that out the door by May the 1st. This is the only way that we save lives. If we don't do this, people will die because we don't have simple medical equipment. It'd be like living in Antarctica with no healthcare system. It will literally be at max capacity, turning people away. Critical care beds. All right, so I don't know how long I'm going on here. Critical care beds. We have total of close to 1 million standard hospital beds scattered across the country, 5,000 or 6,000 hospitals. Here's the deal. There's only 98,000, about 100,000 ICUs that are standard critical care beds, which basically means they have the capabilities for ventilators and such like that. Anyways, getting to it, we're in that 30-day period, there's going to be that surge of blowing the capacity out of the water. We're going to need at least 2 million critical care beds. Might be 3 million. And this is over 30 or 45 days. The only way that we can do this, and you may have seen China building all the hospitals, 10 hospitals in 5 days. Yeah, we can't do that here in America. It's going to take forever. The only thing is to convert hotels now. People aren't traveling; they ain't going on vacation. So convert the hotels. We have 5 million room capacity across 50,000 hospital hotel locations across the country. Now we can. I'm not going to say commandeer. That's 1 out of 3 hotels we need to convert to a temporary intensive care unit to save lives. Straight up, this is where we're going to be shipping all the ventilators. We've got to figure this out. I know Trump just they had a press announcement today talking about sending 2 cruise ships to New York to handle their capacity. No, yes, that's a great idea. There's not that many cruise ships out there. The best way to do it is hotels, and the only way to get ventilators is to print them. So it's time for us to come together as humanity. And if you want to live, like if you have a grandpa or a grandmother or a parents, anybody over 60 years of age, 1 out of 10, 1 out of 15, probably you're going to lose them if we don't do anything. Here's the thing: this is like a terrorist. This is what I was thinking about the other day. It's like a terrorist is coming to the United States saying, "Hey, we're coming. We're going to be quiet. We're going to slip across your border, kill your border control guards. And then we're going to go to every single city. Not going to tell you. And then at one time, we're all going to strike. We're going to beat up your citizens. We're going to take them, drag them to the hospital. We're going to chain the door to every single hospital, not let anybody in that actually needs it. And then we're going to execute 10% of the people in the hospital." Like, put it in that perspective, we've got to go to war with this virus. I would much rather be way overboard with this versus not doing enough. I mean, this can go down in humanity as the time that we came together, put aside our differences, and came together to solve a problem that affects us all. It doesn't matter. A religion, your college education, your bank account, it doesn't matter. This could potentially be you or your family member. So we've got to come together to do it. All right, so I got a bunch of stuff on here. This is what we're doing. Okay, so we're building software to coordinate this. This is a massive coordination platform is really what it is. I'm calling it Health OS. But we need software developers ASAP. I am opening up. We already got a GitHub repository. This is all open source. We are, yes, using Rocket Chat. We're building off that, kind of like a Slack open source platform. Building off that, I won't talk anymore. We need help. We need you to donate money, because each one of these ventilators is going to cost $100, $200 each plus shipping it. Yeah, we could rent all hotel rooms for 2 or 3 months for about 50 billion. So Trump, if you hear this, Zuckerberg, if you hear this, Warren Buffett, Bezos, all your billionaires, the Fed, just print some more money. You do it for all the banks. Match us a dollar for a dollar. So that's my call to action. I'm saying that we are raising money right now to save 2 million Americans. How much is that worth? So yeah, let's get it going. The website is citizenhealth.io. It's going to be straight to the point. This is what we're doing. We've got to move quickly. I don't care if I got to live stream this 24/7 and keep it going and start calling out people to get the job done. We can do this. We got to do it. We've got to try. All right, so I'm going to stop this. Please, thank you for listening to this. Please take this serious. Stay home. Love on your family. Take this time to really enjoy the time together and read a book, learn something new, and share this. Please share. All right. Thanks. Be well.